We're going to bring in our chief medical correspondent, Dr. Jennifer Ashton, right now. There are so many questions that folks have. The first one being, how transmittable is it?
So if we put it into our virus perspective context, it is not as easy to get monkeypox as it is, let's say, to get coronavirus. You can think of this more, as we heard in the piece, direct skin-to-skin contact, usually prolonged contact, but the CDC and the World Health Organization absolutely being clear and really erring on the side of caution that contact with towels or bedding or even close prolonged respiratory contact where someone who's infected may be shedding droplets or even possibly by bodily fluids, sexual transmission, although we have to remember this is not an STI or STD per se. It's really that contact with someone who's infected.
And people are asking, should they be wiping down surfaces?
Well, some people may argue we should be wiping down surfaces for many reasons. Specifically for monkeypox, if you're in an area where there's a high outbreak, of course you want to hit those hot spots because it is possible that this virus can be left on, let's say, gym equipment, just like it can be left on clothes. But hand hygiene, Robin, is the most important thing, not just for monkeypox, but for any infectious disease.
We know there's a vaccine out there. Is there enough to know how effective it is?
No, so let's go through what we know about this vaccine, because it seems like we just got up to speed on our COVID vaccines. The monkeypox vaccine was FDA approved for use in September of 2019. It's made from something called a vaccinia virus. This is a live but non-replicating virus. It does not contain smallpox or monkeypox exactly, though. It has been tested in about 7,800 people in clinical trials. However, the efficacy is unknown. I can't tell you it's 20% effective or 80% effective, and right now it is FDA approved for people 18 years of age and older. It's 2 subcutaneous injection doses, 28 days apart.
And you know about the CDC, the warning over the weekend about children under the age of 8 that they could develop more severe illness if infected. So what do you tell parents?
Right now, parents don't need to panic about this. They should be aware of what's going on with this, as they are with any medical headline. They should know what's going on in their community, and they should take the appropriate steps after discussing any concerns they have with the pediatrician. Children under 8, people with compromised immune systems seem to be at higher risk.
Thankfully, we're not talking about deaths here in the U.S. We're thankful about that. But what are the risk factors?
Well, I think we have to be clear, Robin, and as unfortunate as this is, as the numbers grow based on sheer math, it is not impossible that we will see a death here in the U.S. There have been deaths in Africa associated with monkeypox, but in general, this can be a mild illness. It could be a severe illness. There's a spectrum of severity, and I think we need to be prepared for the numbers to go up significantly.
I know you'll be discussing this again on GMA 3.
Yep,
All right, Jim. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.